Welcome back to Be Kind Pediatrics. Are you wondering what's the big deal with baby wearing and why everyone's doing it? Today we're going to talk about some of the benefits, but we're also going to talk about how to do this safely.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
So why baby wear? Well, baby wearing has been going on across multiple cultures for hundreds of years. And there actually might be some scientific evidence to back this up. So firstly, a lot of the same benefits of skin to skin can be found from baby wearing, because if you're properly doing baby wearing, the baby is essentially skin to skin. So that's going to be firstly warmth. Temperature regulation is extremely important, especially in those first couple of days of life for babies. And so helping them keep themselves from getting too cold helps them maintain normal blood sugar levels. This is especially important for those preemies. And in that specific population, I actually recommend non-ambulatory baby wearing. There are special shirts that are made to do this, but it's essentially called kangaroo care. So there has been evidence to show that babies in the NICU setting who do baby wearing or kangaroo care have reduced mortality rates and improved outcomes. Secondly, babies just really like it. So they enjoy the warmth, the sound, the contact, the scent of their parents. And so it follows that there has been some studies that show, and the AAP recommends, baby wearing, especially for babies who are fussy or crying. It may reduce crying by as much as 43% for babies who are worn 3 or more hours a day. That's a quote from particularly from an older study, but there have been some newer studies that debate the actual utility of baby wearing specifically in colicky babies. However, given its other benefits and if it's done safely, it has very little risk. And so it's something I usually recommend, especially for parents who are struggling with a baby who seems to be fussy or crying a lot. Thirdly, it frees up your hands. So wearing your baby allows you to go about your day and do other things. And it's certainly a lot of it more convenient than a stroller. You are absolutely probably going to also need a stroller, but if you're out and about, you want to just go for a walk on the town and you don't have to worry about bringing your stroller up and down stairs, baby wearing can be a really convenient way to get around. Baby wearing has also been shown to improve breastfeeding outcomes. So there was a study done in pediatrics, it was published in 2021, that showed that infant carrying or baby wearing improved both breast milk success and the amount of expressed breast milk at 6 months postpartum. Lastly, baby wearing, when done appropriately in the right way, may help with infant hip development. So we're going to talk about the right way to do that, but it may be a benefit to baby hips when done in an appropriate manner. And then lastly, again, specifically for that NICU population, there have been studies that non-ambulatory baby wearing, also sometimes called kangaroo care, improves infant weight gain. And so for those little tiny NICU babies who really are working on just growing and getting bigger, this can be a huge benefit to their overall health. So now I've told you all the benefits of baby wearing, and you're probably wondering, okay, that's great, but how do I actually do this safely? And why am I so concerned about safety? So Pediatrics actually published a report in 2019 that looked about over 9 years of data from pediatric ERs and ERs all over the country. And they found that about 14,000 babies were injured infant carrying, either from a parent falling while holding an infant or the infant carrier being worn inappropriately. And besides the broken bones and cuts that were reported, the most concerning outcome was positional asphyxiation, where the baby's airway was blocked and they actually stopped breathing. So we're going to go through all the steps to do this appropriately and avoid those outcomes. Firstly, you want to look at your infant carrier. Your infant carrier is going to have weight limitations on it. So both the minimum and the maximum weight are important here. Many infant carriers have a minimum weight of 8 pounds. There are some carriers out there with a minimum of 7 pounds. Those are going to be brands like Ergo Baby and Baby Bjorn, to name a few. But whatever the weight limit is, you want to make sure that you are not putting your infant in a baby carrier before they are big enough for it. Secondly, until your baby is about 4 to 5 months old, you want them facing you. So they shouldn't be facing outwards if this is your baby in a baby carrier. This position is only appropriate once they're about 4 to 5 months old. Until then, they should be facing inwards like this. Once your baby reaches about 4 to 5 months of age, it is okay to have them facing outwards, but I would recommend limiting the amount of time that you have them facing outwards to about 20 minutes. It is, babies really enjoy this because it's stimulating visually and fun for them, but it can also be overstimulating. So you want to try to keep that time to about 20 minutes. And if they fall asleep, I do recommend switching them back inwards into the inward facing motion. So like this picture here shows, you want their position of their hips and their knees to be in an M position so that their hips are bent and their knees are slightly bent. This is the most appropriate position for appropriate development of their hips. You do not want their hips straight forward and straight down like the second picture. If you want more resources on appropriate position of your baby in your baby carrier, the Institute for Developmental Hip Dysplasia has a lot of great information on how to do this safely and why it might be a good idea for your baby's hips when done safely. Also, you want to be mindful of where you are baby wearing. So I definitely do not recommend baby wearing near water or around water, certainly not on a boat, because you won't be able to get your baby off quickly enough in an emergency situation, and not near water because there are lots of instances where parents bend over and the baby falls out of the carrier. So you especially don't want this near a body of water. Also be mindful of what you're doing, like cooking around heat, using a knife, etc. Speaking of heat, you also want to be mindful of the temperature. So you should treat your baby carrier in general like an extra layer of clothing. I often tell parents that babies need, when it's really cold out, one more layer than us, and when it's really hot out, one less layer than you. So try to think of the carrier as one of those layers as well. Let's talk a little bit more in detail about proper positioning of your infant in a carrier. The first rule of thumb is that your baby should be visible and kissable. So by that, I mean their nose and their mouth should be visible to you. That means that the carrier shouldn't be all the way up past their head where you can't see their nose and mouth. Secondly, they should be high up enough on your chest where you can lean down and give your sweet little one a kiss on the head. Secondly, you want to make sure that your infant's chin is up. So a lot of infants don't have great neck control. Well, all infants don't have great neck control. And so you don't want their chin to be touching their chest like this. That can close off their airway. You want to make sure that chin is nice and up and positioned on your chest in a way that you can see it, something like this. You want the infant carrier to be snug. And the reason for that is you don't want your baby to fall into a C position like that. You want them snug and upright so that it's supporting their back and supporting their airway. So nice and snug, tight fit. You want your baby tummy to tummy with you, again, to help make sure that their spine is straight and not falling into that C positioning. And you want the M position, again, the M position of their hips to make sure that their hip is developing appropriately. This also is just a great example of appropriate infant wearing. So you can see that dad is able to kiss his baby's head, the baby's mouth, and nose are both visible. The baby wearer is nice and snug and tight, and that the baby's tummy is to dad's chest. And again, that the hips are in that M position. So I want to close out by talking about babies that maybe you should consult your physician before putting in an infant carrier, or maybe should not be in an infant carrier. So that first population is going to be those preemies or NICU graduates. Depending on the baby, preemies, NICU graduates can be at higher risk for having lower tone or something called hypotonia. So you want to talk to your pediatrician before you put them in an infant carrier, just to make sure that they're going to be able to have safe airway and also be able to support their back appropriately. For those preemies who are still in the NICU or even post-NICU, you can use something called the sleep belt, potentially in conjunction with your physician's recommendations, but that's a form of non-ambulatory baby wearing. Also, any baby who has respiratory problems, chronic lung disease, or is on oxygen, you really want to talk to your provider about before you put them in an infant carrier and make sure that they're going to be able to have their, be able to maintain their airway in a carrier. And lastly, are those babies with developmental hip dysplasia or in a pelvic harness. They should not potentially be in a baby carrier, or if they're going to be in a baby carrier, they sometimes need special positioning. So definitely talk to your provider about your child being an infant carrier if they have developmental hip dysplasia or an pelvic harness. I hope you guys find this video and information helpful and empowering to you. And if you have any questions or concerns about baby wearing, please leave them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.